Hi, I'm Dr. Charles Cobbs. Welcome back to BrainCancer.org series of lectures on brain tumors 101. Getting back to how you deal with the diagnosis of a brain tumor. In the last lecture I mentioned that it's reasonable and most preferred for patients to consult with maybe more than one provider. Typically, if I have a brain tumor patient who comes to see me in clinic, they come with a CD or films on a disc, and we review the films. But first and foremost, I sit down with the patient and I talk to the patient about their past medical history and the history of how this evolved. Sometimes that will give clues to how long the tumor has been around. For instance, if they've had symptoms for over a year, then we know that it's most likely going to be a low-grade or slow-growing tumor. When we examine the patient and then review the MRI scan with the patient, then we are presented with a whole host of different possible ways of going about treating the patient. Unfortunately, one of the more common diagnoses we see here are gliomas and malignant gliomas. And then what we decide to do at that point ranges from one extreme to the other. Our current thinking in terms of treatment of low-grade gliomas is to try to perform an aggressive resection of the tumor and to remove as much tumor as we can if it's safe. Similarly, if a patient has what appears to be a malignant glioma or a glioblastoma, we also would like to remove as much tumor as we can in order for them to maximally benefit from subsequent treatments such as radiation and Timidar. The location of the tumor in the brain and the amount of infiltration of the tumor into the brain does make a huge difference in terms of what our strategies will be in terms of surgery. The patient can expect that the surgeon, or the neurosurgeon in particular, will want to go over the MRI, discuss the location of the tumor, and then discuss the various techniques that can be used to isolate the tumor from important structures such as the motor area or the visual cortex, and to use other navigation techniques such as a computer-assisted navigation to elegantly remove tumor and separate it from critical structures. All of these things are typical for patients to be presented with when they come to see a neurosurgeon after the diagnosis of brain tumor.